Hello, welcome to the webinar of today, which topic is writing time management and types of letters. And I am Dr. Rana Umair Khan. So I cordially welcome all of you. And I just want a confirmation that all of you can hear me.
Yes, sir.
Hello.
Yes, sir.
Sorry,
Hearing.
can you hear me?
Yes, sir. Hearing.
Okay. So let's start the today's webinar. And as all of you know that its topic is writing time management and types of letters. So first of all, we will start from how we are going to manage the time. As all of you know that you only have 40 to 45 minutes to complete this task of writing. And most of the students struggle with the writing subtest of OET. So I am here to guide all of you regarding the time management of writing subtest. So first of all, the most important thing we are going to focus is case notes. The first step you're going to do is skim through the case notes, so just take it as like, you are reading a novel, and you are, you know just consider it a novel, and it will make it interesting. So you consider that you only have 5 minutes to read something which is worth reading in 10 minutes. When you will work harder than you are expected, then you will always succeed. So important thing is you have to skim through case notes. Skim means, you have to superficially read it. First of all, you have to, catch those phrases, or you and those headings, or those presentations or complaints the patient is going through. And many other things like past medical history. Then you have to see what type of letter it is. Then you, as you are holding a pencil in the writing subtest, I will suggest you to add stars. For example, if the patient's medical history is significant for hypertension, or you can say diabetes mellitus, and it's relevant for your letter, then you can add star to it. Okay. So why I'm telling you all of this, because when you will add stars, when you will underline important points and other points I'm going to tell you, then you will save time. Then for example, if the patient is, as we discussed, is undergoing, he is suffering from hypertension, and you have started, and he's also suffering from, you can say that hypertension, diabetes mellitus, both are being starred, then important points you can underline them. So what can be important points you can underline? So I will say that you make categories. There will be important points in the case notes. You have to, for example, you can say you have used stars for the past medical history, then you underline the important points. You can categorize it like, for example, the presenting complaints can be underlined. For example, the findings of examination during all the visits can be underlined. Then another option you can have is encircle the important words. So encircling can be, very beneficial, as when you are coming for the second read of the letter case notes, then the encircled thing will never, go unnoticed. So as you have very precise, you have to be very precise, you have very less time for writing subtest. I think these strategies will help you in saving time. So you can also use the numbers. You can number the notable symptoms slash past medical history. Okay. So what we discussed in this slide is you have to skim through the case notes. You can use add stars, you can underline, you can encircle, and you can number the notable symptoms. So are you students with me? Please give me the feedback. Are you hearing me clearly? Please give me the feedback.
Yes, sir.
Okay. So as we discussed in the last slide, how we are going to, underline and circle different symptoms, sign and symptoms, dates, these are a few strategies which you can use to save your time. Then Another important thing is information to avoid. Basically, there is an overflow of information in case notes. Basically, what they demand from you is that there are at least, you can say that around 400 words, and you have to compress the letter into 180 to 200 words. So how are you going to do that? You are going to do that not by summarizing, but information info. You have to know what information you have to avoid in the letter. For example, do not ever mention slash underline normal findings of any investigation, as it will consume time and exceed your word count. So basically, I also mark letters, and I am working with med exam expert, and some unbelievable and very important channel for guiding students for OET. And they give me letters to mark, and I see that the major mistake the students make is they write the normal findings. For example, if a patient visited and in the case notes it's written that his examination was normal, his abdominal examination was normal, and other things were normal, you don't have to mention that. So basically, you only have to write the pathological findings, not the physiological findings. Okay. So do not mention those diseases in the past medical history which are unrelated to the presenting complaints of the patient. Only mention relevant diseases. For example, I can recall a letter in which there were case notes, and the patient was, suffering from a load of diseases, and he was suffering from a dozen of diseases in his past medical history. But for example, if he had, you can say that presented with abdominal pain, so you can say that which is relevant for his past medical history. You can say that he can be suffering from any medical condition that can cause abdominal pain. In this case, other diseases will become irrelevant. Okay. For example, if we had a tetanus, or in the past, or if we had a tonsillectomy, they are not relevant with the abdominal pain. So you have to see which medical conditions in the past medical history are relevant with the presenting complaints. Okay. So you may think that also those diseases are not, you can say they are worth mentioning. But if you will mention all those diseases, you will be exceeding the word count, and when you will exceed the word count, then you are not going to score good. So do not mention that examination was normal or unremarkable. So basically, all I am telling you that you only have to see the positive findings. For example, positive findings means if you did an examination and there was something, you can say that, for example, there was a patient in the case notes, and he had got his, urine culture or urine complete examination. And you can see there are a lot of parameters we can check in urine complete examination, but we will only write those findings which will be positive. For example, there can be leukocytes or pus cells in his urine complete examination, and other things are normal. So you're not going to write all the normal findings. You will only write that the patient had, for example, the line will be his examination revealed leukocytes in the urine complete examination. Okay. So next, only write pathological findings, not physiological findings. So as I told you that there in the case notes, there will be many findings. Some will be relevant, some will be irrelevant. So you have to see what actually the problem of the patient is, and why the letter is being written. It is very easy. You just have to focus on these few things. It's not complicated. You just have to take it easy. you know I've made these slides very compact and precise, and you can focus on these things, and I think they will be really helpful to you. So are you students with me? Can you listen me clearly?
Yes, sir.
Okay. So how's the webinar going so far? Are you understanding the points I'm telling you?
Yes, we are all understanding it.
Okay, thank you so much for your feedback. That was really helpful. Let's move on. Okay, so this is the basically, example of a criteria on which you are judged and scored in the professional OET exam. So there are many other, criteria written, but right now which is concerned for us is this portion, conciseness and clarity. So it narrates that whether unnecessary information is omitted so that letter is an effective summary for the reader. So I think this paragraph beautifully summarizes and explains about what the today's webinar is about. You know, today's webinar is about the summarizing and avoiding the information overload and summarizing and do not exceed the word count. So if you are not concise, you will not score good marks. And if you are have summarized and concise the letter, then obviously you are going to pass with flying colors. So other information is really irrelevant right now, and we will move on to our next slide. So next topic we are going to discuss is save time while writing. So first of all, you have to focus on the task. If you see the case notes, there is a chronological information of the patient, of the disease, of the visits, and after that the task is written at the end of the letter. For example, it can be a referral letter, it can be a discharge letter, it can be a transfer letter. So they have clearly mentioned, and you have to see that what is the task. So after that, give case notes a superficial read. Write the address, date, reference, name, only then focus on your case notes. So what I'm trying to do is, that I'm telling you that you just have to focus on the task. You have to write these headings in the order I have written. For example, address will come first, then will be the date, then you have to write the reference of the patient, then you have to write the name of the doctor, and only then focus on your case notes. Why I'm trying to tell you is this, that when you will write these things, you will not focus on that I have to write this. You will only focus on case notes, and you will write about the patient. You will be done with the first part of the letter. This information is about the first part of the letter. Okay, so these are the things. For example, if the address of the doctor is, for example, he is some kind of a psychiatrist and he works in a new Hull hospital in for example Birmingham, you will write the address, then will be the date, then will be the reference, then will be the name. Okay, so I'm trying to tell you is this, you have to complete the first portion of the task first, and only then focus on your case notes. It will save you a time, and you will not make any mistake. Okay, so this way you will be done with the first part of the letter in no time, less chance of mistake, and all focus on the body of the letter. So basically the letter consists of an initial portion, then there is the body, and then there is the ending of the letter. So I'm trying to tell you that we're done with the initial part of the letter first, and then focus on the body of the letter. Then next point I'm going to tell you is this, that you have to memorize the format of the letter. There are many ways to write a letter, but I believe that you have to memorize the letter and stick to it, especially, for example, in a referral letter. Okay, so I will tell you the general format, but every person has his or own format. There is nothing like you can say that a compulsory format have to be followed. Sometimes a complicated scenario can come, but we have to follow the format, and you have to make your own format. I will tell you in the next slide. So for example, as we discussed that, first of all, we are going to write, address of the patient. In this, the date has been written. First of all, you can write like this, or the date can be down. So as I told you that everyone has his or own his format. Okay. So first of all, the address of the doctor will be written, then will be the date, then will be the doctor's name, then will be the reference, and then comes the date of birth. Okay. Okay. So first, as I told you, the initial part of the letter, there will come the body of the letter. So, okay, there are two types to write, date can be above or date can be down. Okay, so next, now move on the next slide. Pro tips to save time. Practice at least 30 letters before your exam. This is very important. Some people are very confident in writing letters. They say that we will write 5 to 10 letters and that will be it. But you have to write at least 30 letters before your exam. Write the letter with the stopwatch on. So when you practice the letters, you have to, time the letter. How much time you are taking to write a letter. Try to read the case notes in 5 minutes. So when you are given the case notes, as I told you, the strategies, how to underline, how to star, how to number. So these strategies will help you to underline or filter out important information. So when you will be practicing 30 letters, there will be a bright chance that you will ace your exam. And try to write a letter in 25 to 30 minutes. Read the case note in 5 minutes and try to write a letter in 25 to 30 minutes. Leave 5 to 10 minutes at the end to proofread it. So proofreading is very important. 5 minutes will be designated for reading the case notes. The letter will be of 25 to 30 minutes and leave 5 to 10 minutes at the end to proofread it. Okay, then pro tips and tricks. Do not write rough, only focus on your original letter. Writing is after listening and reading. So basically what happened with some people is that there is some space in the writing subtest booklet and they say that you can write rough. So it's just a distraction. You don't have to write rough, only write the neat letter, as the time is very less. And writing is after listening and reading. So you are very tired, you are super exhausted, and you have 40 minutes to write the letter. Consider this subtest the most challenging. Believe me, don't underestimate the writing subtest. It is very challenging and you have very less time. And mostly the letters formats which are available online, they are not standard. The case notes you see in the paper, they are very extensive. There are multiple visits. There are at least 4 to 6 visits in there. So do not take it easy. You are lucky if you receive a case notes in which there will be 2 to 3 visits, but you have to know how to concise and how to summarize the case notes. And one thing is important, that if you complete your listening and reading subtest in time, that doesn't mean that you have a lot of time. Every subtest have its own time, and if you do not complete your task in time, they are not going to give you any extra time. The staff is very punctual about time, and they're very strict about their rules and regulations. So there are some things that are seem very common, but they're very important in determining our future. So I would suggest you that you sharpen your pencils before the exam. Take at least 4 to 5 pencils with you. It will be really helpful for you. You can write with it in a neat manner. For example, if you take 1 to 2 pencils with you, you have to sharp your pencils again and again and again and again, and it will take your big chunk of time. So if you feel a big chunk of your letter is not correct, instead of raising, simply cut it like this, as raising will take lots of time and leave your paper untidy. So in paper, it happens with lot of, doctors, that, sometimes you feel like the structure of the sentence is not right, or there are a lot of grammatical mistakes. So sometimes, for example, some students are going to raise the complete paragraph. Don't do this. Simply cut it like this. So why I'm trying to tell you this is because it will be going to save your time, and the paper won't look untidy. So biggest tip, if you are out of time and only 5 minutes are remaining, I would suggest you that to wind up your letter, write the last 2 concluding lines and finish your letter. As start, body and ending of letter carry separate marks. So this is very important. You have 40 minutes in the exam, and sometimes it happens that the case notes are very extensive, or due to any reason you feel like that you cannot match up with the time. So I would suggest you that write the last visit very quickly, and then write the last 2 concluding lines and finish your letter. The last 2 concluding lines, for example, they can be: in view of the above, I believe that the patient needs your urgent care and assessment. And if you have any queries, please do not hesitate to contact me. So write these 2 lines, write yours sincerely and doctor, and complete your letter. So why I'm giving you this tip is because if you do not write the ending of the letter, it will be going to affect your exam very negatively. So that was all about the uh, saving time while writing the letter, and I tried my best to give all the pro tips and tricks. And I really want all of you to succeed with flying colors, and I hope that all of you learned something today. So are you with me? Are you getting my point? Students, can you hear me?
Yes, sir, we can hear you.
Okay, thank you so much for your feedback. Then, there's a second part of our webinar that is about types of letter. Mostly 90% of the times there is a referral letter, then there is a transfer letter, then there is a discharge letter. You have to focus on the referral letter the most, because 90% of the times it comes in the paper. There can be a transfer letter, and there can be discharge letter. Don't be get confused while writing transfer letter and discharge letter. They are very much simple. The format is a little different, but everything is quite the same. So there is 90% of the times it's the referral letter, but also discharge and transfer letter can come. So you have to practice that as well. There's a slight difference, but you have to know that difference. So what is the basic difference? Transfer letter, it means from one specialist to another specialist. Referral is from GP to specialist, and discharge is from specialist to local GP. So basically, you have to focus on the task. You have to know that where the patient is being presented. So you have to know the pattern, and you have to, mostly it is written at the end of the letter that while it is a referral letter or something else. So you have to focus on that. What are you while writing the letter? If you are a specialist writing to another specialist, it will be transfer letter. It is, if it is from GP to specialist, it will be referral. If it is from specialist to GP, then it will be discharge letter. So this is the basic difference. Keep this in your mind, and it will help you in identifying the type of letter. So there is a lot of difference between these letters, which detailed difference between these letters is out of the scope of this webinar, and we will discuss it in our live sessions. So till now, if you have any question, please feel free to ask me, and I am there to address your queries.
Hello, sir. Assalamu alaikum. I hope you are doing well. Can you please tell us that what are the mistakes that are considered as the major mistakes and that are going to result in losing a lot of marks? We won't be having margin of passing after doing that mistakes. Yeah, the things that we are supposed to be vigilant about.
Yes, that's a very good question. As I told you that, first of all, if you specifically ask about the finished product, that is the letter you have written in the subtext, I would say that the major mistake would be missing the initial part of the making a, for example, if you write the address after the date and dear doctor and after the name of the patient, so you have to basically keep memorize the sequence in which those components are being written. First of all, that is important. Then the ending is very important. For example, the last two lines, they are pet same in most of the letters, that is in view of the above, and in case of any query, you have to write these lines even if you are missing on time. And then at the end, if you are missing yours doctor and sincerely, it will be affecting very negatively. And in the mostly the mistakes in the are in the body of the letter. No much how much pro are you at English, you are going to make mistakes, and that's all right. You only need 350 for passing OET. I'm talking about doctors. So basically you have to focus on the starting and ending the most. Although the body of the letter is equally important, and main chunk of the letter, but at least secure your place by writing correctly in start and the end. I hope that addresses your concern. Any other questions, please?
Well, thank you so much. This was a very good explanation to my question, but my question is more inclined towards the grammatical mistakes and the errors of spellings and article and punctuation mistakes. So my question was more inclined towards the body, that what mistakes we are not gonna be spared in the body thing.
Okay, I got your question. Well, I believe that, the major mistakes you are going to make in the body of the letter is, of the tenses. Sometimes, the case notes are so extensive that most of the students, as I check the letter at med exam expert, we also assess the letter and we give the feedback, detailed feedback. And most of the letters sent by the students, they combine 3 to 4 sentences in a single line without even considering and regarding the, grammatical mistakes, without taking in consideration of the grammatical rules. So basically there are a lot of mistakes, all kinds of grammatical mistakes of article, of pronouns. There are very simple mistakes sometimes. So what I would suggest you is that, you keep your letter simple and do not make it complex, do not make it complicated, and keep it simple.
All right, thank you.
So any other questions?
Yeah, am I audible to you?
Hello, I can't hear you clearly. Can you please speak again?
Am I audible to you?
I'm so sorry that, I can't hear you properly, and I think that you should check your internet connection. Any other questions, please?
Sir, when is your next webinar?
Well, I'm not sure about that, but it depends on your feedback and what you learned today. And I hope that our next webinar will be about types of letter, but that's not confirmed yet. You can attend our live sessions, and obviously we are going to introduce our full length courses and mini mock tests as well, about which I will tell you in the next slides, and you can take those assessments as well. So basically the purpose of these webinars is to introduce to what is OET and what mistakes you people make. But the real game begins when you write the letter and when you do listening and reading. So we have designed some packages for you. For example, you have to know, do you know where you stand, and you have to know even you need help in assessment or not. And the next thing which is important is what level you think suits you the most. So let's discuss is, we have made some plans regarding this. If you are a beginner, we have introduced a writing feedback for 8 letters and listening for 10 tests and reading 10 tests. And if you are at a mediocre level, if you have a moderate understanding of English, then you can get 5 letter assessments and 5 listening tests and 5 reading tests. In the same way, if your exam is near or you feel like your English is well and you can perform well, or even if you are appearing in OET again, then you can take 3 writing letter assessments, 3 listening, and 3 reading. And along with it, there will be one-to-one speaking session that will be free. So basically, what we are trying to do here is facilitating you to success, and we are with you, and you have to know that where you stand, and you can take these plans according to your requirement and your test. And for people who are appearing in OET in November and December and January, you can start our regular live sessions, which are going to start with from November. And I hope that will be really helpful for you acing your exam with flying colors. So, from starting from the first week of November, all 4 modules will be included, and regular classes will start from November. And you can also take these assessment plans as I told you in the last slide. So, any other question?
Hello.
Yes, I can hear you.
Yeah, I want to ask that if in the letter section, some kind of tests are requested on one consultation. and the results
Yes,
of them are reviewed on the next consultation. Do we have to mention that they are requested on this date and reviewed on that date? Is it important? Or we just have to
like,
mention on the review of tests?
that's a good question. That's very important, especially when the case notes are extensive. When in the case notes it's written that the following tests were requested or advised, don't write that in your letter. I already told you that you have to write only pathological findings. So you simply take this as a thumb rule, whether it is a this line is a pathological line or a physiological line. So if you read this line that following tests were advised, it is not a pathological line. For example, the patient comes in the next visit and he says he gives you your lab, he gives you his or her labs, and there is something wrong with his x-ray, then that is a pathological thing. All other normal labs won't be mentioned in the letter. If you will be mentioning normal conditions and normal lines, then you will be exceeding the word count.
And also, there are some cases in which the assessment of, let's say, mania is made. And
Okay.
in the background, they have said that the GP has assessed for uh, UTI or for upper respiratory tract infection. Do we have to mention that?
For example, if the assessment of mania has been already made, as you mentioned, then what's
Hmm.
the point of mentioning those conditions? Because these have been ruled out already. But sometimes, if you see that that condition is relevant or will be relevant in the next paragraph, then you can mention that. So it depends on the letter, type of letter. Mostly, what I'm telling you is about most of the letters. 90% of the times, you won't have to mention the normal findings on our normal tests. I hope that addresses your concern. So, any other questions, please? So that will be all. Thank you so much. And you can reach us at this number provided at the slide, and you have also a website and email as well.
Thank you so much, sir.
Thank you so much. And how was the webinar today? Can you please give me a feedback?
It was very helpful.
So, sir, it was amazing, but I want to request you one more thing. Some people have asked the questions in the comment box. Can you read the questions for them because their voices are not were not clear, or they were unable to turn their mics on. So they are asking again and again in the comment section. Can you have
O-
a look over there?
Okay, please give me a minute. I will be going there. Okay, there are 57 messages. Okay, so starting from the beginning. So, Ms. Shazia has asked difference between three types of letters, and I told the basic difference at the slides written at the end. And I also told you that what is the difference between discharge, transfer, and referral letter. But I also told you that the detailed difference is out of the scope of this webinar, and I hope that we will address that in the next webinar. And then when will be my next session? I'm not sure about that, and but we will update you before we conduct it. And I address that concern of Miss Anusha that you do not have to write normal findings. Then Miss Shazia asked the format of address, date, and name will be the same in all three types of letters. Finishing line also same. So basically, the format of address, date, and name will be the same in all three types of letters, but the finishing lines can never be same in all three letters. We will discuss it in our next webinar. So Ms. Shazia has asked about conducting webinar about listening and reading part C. Okay, we will send it to our team and we will see what we can do about it. Dr. Nurul Ain asks, what are we supposed to write our name at the end of the letter? No, you simply have to write yours sincerely. You leave 2 lines and you have to write doctor only. Okay, Miss Anusha asks this, the format of starting the sentence. Both are right. You can write, I am writing to refer, and you can also write, thank you for seeing this patient. As I told you, there's not any, pet pattern. You can, you can be flexible, but you have to see that in the, you are not making any grammatical mistake, or you are in the boundary line of the, you can say the formal letter. Miss Anusha asks how we can write the 38-year-old or 38 years old. The first one is correct. You have to write 38 dash year dash old. Next, you have to mention that man or woman. Okay. Okay, Miss Anusha asks, do we have to write diseases with small letters? Yes. The first letter will be small. After yours sincerely, you have to leave 2 lines. Then you are going to write doctor. Then Miss Anusha asks, you have to put comma after your sincerely. It depends. If you put a comma after, dear doctor in the starting, then you can, write the comma. If you didn't write the comma at the start of the letter, then you don't have to put comma at the end. Well, this is a very good question, that how many finger spaces should be given on the left and right side of the letter. Please keep it in mind. I mark the letters, and in some letters many students have left 1 to 2 finger space at the left side of the page. Don't leave that, and start your letter from the extreme left. Also leave 1 line after the paragraph. So don't write the symptoms of disease in abbreviated forms. As I mentioned above, that the drugs names, if it is a brand name, then you have to start with a capital letter, and if it is a generic name, you have to write with a small letter. So many concerns were addressed in this webinar. It was a very coordinated webinar, and I also took feedback from you, and I hope I addressed all of your concerns. So did you learn something new today? Was today's webinar helpful? Please give your feedback. Okay, thank you so much. There are a lot of positive reviews in the chat section, and I'm so glad that it was a successful webinar, and we are hoping to conduct more webinars like this. And you can take 1-to-1 speaking sessions. Moreover, the letter assessments can also be done, and we will guide you further for acing your exam. So thank you so much for your time, and best wishes for your exam, and book your packages as soon as possible, so you can help you in acing your exam. Thank you so much.